An exercise high is felt by my athletes after they finish their exercise routine. If you talk to any athlete, whether an amateur or professional, they usually have a great sense of satisfaction after they're finished with their exercise. And it's because of a chemical occurrence. When you exercise, you turn the adrenal glands on to secrete adrenaline, norepinephrine, and epinephrine. And you probably have heard of those hormones before. They're the ones that actually turn on the stress response. In exercise, you actually will throttle the stress response. You don't want to turn it on 110%. You just want to turn it on enough to get through your practice, your exercise, your endeavor, your competition. And then you back off. But usually because those hormones then turn into endorphin and enkephalin, those get into the brain and the brain says, I'm happy. The thing is, usually the adrenal gland will taper off and stop secreting after about 30 to 60 minutes. It's because your body is not meant to be in stress response all the time. Even if it's a throttled stress response, you're not supposed to exist in that all the time. And that's what I wanted to do this video for. Is a lot of my patients that come in to see me for lifestyle change, I'll always ask about thinking, eating, and activity as being something we can manipulate or change or work on. And some folks will come in saying that they exercise on a routine basis. But they'll use that answer when I ask them, how do you relax? Exercise isn't really relaxing. I mean, you can feel good afterward because of what I just explained to you, but it's not relaxing. Turning on the parasympathetic response or the relaxation response is what I'm talking about with relaxing. And it can be in the form of, you can experience it in the form of reading a good book, getting a good laugh, being with friends, eating good food. But actually, if you want to really drop into it and have maximum effect of serotonin, that's what I call the serotonin high, you have to practice at least 30 minutes twice a day is what we're taught at the Chopra Center. I give my patients a break and say, okay, maybe when we're starting out for the first 3 months, 5 to 10 minutes twice a day as best as possible. And I'm compromising, but I think that's what some of my patients need. And if you do that on a regular basis, that means the body gets this secretion of serotonin and oxytocin that floods the blood, gets to every cell, gets to the brain, and makes you feel good. If you've ever gone out on at a meeting, say a meditation practice, it's called an immersion. You go to a yoga practice, you go to a yoga teacher training course. Usually when we leave those places like the Chopra Center after about a week, most of us that have participated come back, and for at least a week to 2 more weeks, everybody's feeling great. Ideas are abounding, problem solving is quicker, sleep is better, relationships are better, always happy. Kind of like the hippie that comes back from a concert. And that's not from marijuana, that's actually from being happy. That's serotonin and oxytocin. And I do think that those 2 hormones, when you secrete them and bathe your blood, bathe your cells on a regular basis, I think your serotonin and oxytocin can stay longer, effectively higher and longer in the bloodstream and have maximal effect for a longer amount of time than the stress response does with endorphin and enkephalin. So because the human body actually is made to procreate, made to continue existing, made to eat properly, made to share in family, I think that those 2 hormones in particular, when they're maximized and when you're constantly exposed to them, I think the human does better. I think disease is better controlled. I think family and problem solving is better. I think social strata and community is much, much better. There are still ongoing studies to figure out the differences between the stress response and the parasympathetic response, but evidence-based medicine says it's still more beneficial than not doing it at all. And when people come to see me as a physician, usually people will be in a state of inflammation. They'll have diabetes, high blood pressure, difficulty with sleep, or a climbing cholesterol level, or just a difficult waistline that they're having a problem with. And I think it's usually because we're lacking a couple different things, but definitely lacking practice for the parasympathetic or the serotonin high. Once you start to experience it, you will never let it go. Just like the endorphin rush from extreme sports. But the good thing about the parasympathetic high, the serotonin high, is that it's not that dangerous. And you can do it in the comfort of a small room in your house, with very little equipment. So why not try it? I mean, we can do that. The physician can actually induce that with you with giving Zoloft, Paxil, Prozac, and Lexapro, but it's a false serotonin high. It's actually I think it's a very flattened affect that people get when they're on those kind of medicines. I mean, they're very useful medicines for the diseases when they're severe, but if you can do it naturally, then why not? It does take practice, though, and to just watch one of my videos and try to get your practice past the 3-month mark is going to be a little bit of a problem. I think it usually needs some form of a coach to help you design something that's best for you. I have my suggestions as far as hiking, breath work, yoga, breathing, but there's many different other ways to do that you might be able to investigate with a meditative coach, a counselor, a psychotherapist, or psychologist. It just is a matter of finding somebody to help you. But don't be too frustrated if there's nobody in your area. There are DVDs, there are videos online. Just have to be careful about who you get the advice from. So hopefully this does point you into the right direction as far as why I always embrace some form of relaxation practice. And hopefully you can see that it's just as valuable as my athletes getting out there and exercising.